Hi, welcome to this short exploration around social vulnerability in humanitarian contexts. I'm Tabitha Hrynick, a researcher with the Social Science and Humanitarian Action Platform, or SHAP. Drawing on years of SHAP work around these topics, we'll consider key concepts and ideas around vulnerability in humanitarian crises to help you, first of all, understand the complex interplay of social factors driving vulnerabilities in crises. 2. Identify vulnerable groups in humanitarian emergencies more effectively. And 3. To overall improve the impact and equity of your interventions as a humanitarian practitioner. A good starting point is to understand what it even means to be vulnerable. To be vulnerable is not a fixed state, but a condition that can affect individuals, communities, or populations in various ways and at different times, and which can change over time. Firstly, being vulnerable often means having limited ability to meet your basic needs. This could involve struggles with accessing food, clean water, shelter, or healthcare. Secondly, vulnerability exposes people to an elevated risk of harm, whether physical, mental, or social. This increased exposure can manifest in many forms, from higher susceptibility to diseases to greater risk of violence or exploitation. Thirdly, vulnerable individuals or groups often experience a reduced capacity to anticipate, cope with, resist, or recover from hazards or crises. This might mean having fewer resources to prepare for a natural disaster or facing greater challenges in rebuilding lives after a conflict. Fourthly, those who are vulnerable face a heightened susceptibility to rights violations, exploitation, or abuse. This could involve being more likely to experience discrimination, violence, forced or coerced labor, or other forms of mistreatment. Lastly, vulnerability often entails having restricted access to resources, opportunities, or decision-making. This might mean being excluded from education, employment opportunities, or having limited say in the decisions that affect a person's life. Importantly, vulnerability isn't inherent to specific groups, but results from complex social, economic, and environmental factors. As we explore this concept, remember that vulnerability can change over time and varies greatly depending on the context. Our goal in humanitarian action is to understand these nuances and work towards reducing vulnerabilities while building on existing strengths and resilience. In humanitarian action, as well as development programming, health services, and a whole range of domains, the concept of vulnerability is understood to refer to the characteristics of people, households, or groups, such as their gender, age, or whether they have a disability or any other number of characteristics. This adapted definition that you see on the screen from Wisner and colleagues captures this interpretation while connecting it to context and the outcome of being vulnerable or not, that is, one's ability to meet basic needs and exposure to risk and harm. It says, vulnerability is the characteristics of individuals, households, or subgroups and their situation and context, which influence their capacity to meet basic needs and their exposure to and risk of physical or mental harm. You might want to pause this video for a minute and consider whether you think anything is missing from this definition or the explanation of what it means to be vulnerable from the previous slide before moving on. Next slide. Next, let's take a look at an example which literally illustrates and provides a rich picture of vulnerability in a particular humanitarian context. That is, Rohingya people living in refugee camps in Bangladesh after fleeing persecution in Myanmar. This graphic illustrates the results of a vulnerability assessment done in one of the camps by the organization ACAPS. It depicts different dimensions of vulnerability: economic, sociocultural, status, safety and security, and environmental, as well as the characteristics of people and their situation in this specific context, which compromise their ability to meet their basic needs and puts them at greater risk of various harms. For example, social roles, gender, age, disability, income, education level, and sexual orientation are identified as variables of individuals' characteristics that make some people more vulnerable in this context. Other characteristics identified include whether someone or a household is registered in the camp, how long they have been displaced, or where their shelter location is within the camp. This graphic also illustrates the specific harms to which people in this context are more or less vulnerable. For example, child marriage, gender-based violence, flooding, and many more. You might want to take another pause to study the illustration further, as well as appreciate how effective visual communication can be. Next slide. So we've considered what vulnerability is and what it means, but what actually makes people vulnerable? It's really important to understand this so that we can address and mitigate these drivers, some of which are longer-term processes and some of which are acute and immediate in the context of a humanitarian crisis. As you can see in this tripartite framework, vulnerability in humanitarian contexts is rarely the result of a single factor. Instead, it's often a complex interplay of three key elements. Firstly, in the purple circle, we have the pre-existing context. This refers to social marginality, inequality, and power relations that create and perpetuate underlying conditions of vulnerability that exist within a community even before a crisis occurs. For example, in many contexts, women and girls, especially those who are poor, and people with diverse gender identities are often more vulnerable to exclusion or violence, even when an acute crisis is not occurring. Second, we have the crisis itself, shown in the green circle. This could be acute hazards like extreme weather, a geological event, a disease outbreak, or an outbreak of violence, or more protracted crises like prolonged conflict, displacement, and climate change. These events can create new vulnerabilities for people who weren't previously vulnerable, but they certainly always exacerbate existing inequalities and deepen existing vulnerabilities. The third element, represented by the orange circle, is the response to the crisis. Ironically, emergency responses often contribute to vulnerability as well. If a response is too narrow in scope, top-down in its approach, inflexible, not very inclusive in its design or decision-making, or blind to aspects of the local context, it may inadvertently make some groups even more vulnerable. For example, during COVID-19, many countries enacted lockdowns with very narrow objectives of stopping the spread of the COVID-19 virus. This prevented many poor people who depend on daily and often informal labor from being able to afford their basic needs like food, medicine, and shelter. In essence, vulnerability is not just about the crisis itself, but about how that crisis interacts with pre-existing social conditions and how response is designed and implemented. By understanding this framework, we can work towards more inclusive, context-sensitive responses that truly address the root causes of vulnerability. Next slide. So knowing what we know about vulnerability now, that is what it means to be vulnerable and what makes people vulnerable, what do we do about it in a humanitarian context? Well, the first critical step is to identify and understand vulnerability as it is emerging and shifting in the context you are working in. Who is vulnerable? What are they vulnerable to? What is driving their vulnerability? How can responses be adapted and designed to address it? There are a number of ways you can gather intelligence about vulnerability in a humanitarian context. This can include discussions and engagement with local people, including local officials, health workers, community leaders, and importantly, diverse residents from different genders, ethnic backgrounds, religious groups, etc. You can also consult with social scientists who are working in, or who know the context really well. In fact, there's a wealth of social scientific knowledge already out there that may provide you with some foundational knowledge about the context in which you are working. In fact, you might find a helpful resource on the SSHAP website where there is a wealth of resources that have been designed to pull together relevant social science knowledge which is related to vulnerability in a whole range of global contexts. You can also undertake some operational social science research. Social science informed approaches and tools, such as participatory vulnerability assessments, can be used to understand vulnerability in a context. Many are designed more for use during non-emergency times, and their results can be really helpful, both for recognizing and addressing underlying and longer-term drivers of vulnerability during these non-emergency periods, as well as for anticipating new or deepened vulnerabilities in the context of an acute crisis. Worth mentioning is one tool called the Barefoot Manual for the Rapid Assessment of Vulnerable Populations, developed by anthropologist David Napier. It describes a structure for crisis time vulnerability assessment, which also takes into account community responses and external responses in addition to identifying vulnerability. Next slide. There are many more things to take into consideration when trying to identify and to address vulnerability, but given this short presentation, I'll just share 3 final ones. First, data disaggregation. It's crucial to collect and analyze data that's broken down by key aspects of social difference. This often includes gender, age, and ability or disability, and other locally relevant dimensions of vulnerability. But it's important to remain flexible. As you understand the local context more deeply, new or more specific dimensions of vulnerability may emerge that point to the need to collect additional disaggregated data. However, this leads to our second point, which is around the idea of intersectionality. There's often a tension between identifying standalone characteristics associated with vulnerability, like gender or age, and recognizing the complex realities of people's lives. Individuals don't exist in single categories. They have multiple identities and face various challenges simultaneously. This concept of intersectionality is illustrated in the example given in the diagram here, in which someone may have a marginalized gender identity, they may be from a migrant background, and they may also have a disability. The specific combination of these 3 factors and what this means in their context may be what is driving a very specific type of vulnerability that they are facing. Lastly, but crucially, there's a need to recognize that people and communities are not just vulnerable, they also possess valuable knowledge, skills, and experience, and their own networks and strategies, which should be recognized, supported, and built upon as part of emergency responses, as well as processes of longer-term positive change that address the underlying drivers and dynamics of vulnerability. But expanding further on that is for another video. Next slide. Thanks so much for listening to this short presentation on social vulnerability in humanitarian contexts.